Neuroscience panel focusing on music and dementia during Brain Awareness Week. In this panel, we will be exploring the link between an intersecting area of neuroscience and the arts, how music can be used as a therapeutic tool for those diagnosed with dementia. My name is Fatma, and I will be hosting this panel alongside Ray. Joining us here today are Professor Louise Serpell, Dr. Karen Marshall, Dr. Laura Hughes, Frances Lynch, and Rebecca Kirkby. Before we begin the panel discussion, I would like to ask that if you have any questions for the panel, please type them into the Zoom chat. First and foremost, we'd love for each of you to say a few words about yourself and your work with music and or dementia.
Shall I start?
Yeah, sure.
Sure. Okay, because on Zoom it's always a bit awkward to know who's supposed to start. So I'm a professor of biochemistry at University of Sussex, and I work on Alzheimer's disease as a research project. I'm interested in how it's caused, and we've recently done a public engagement project working with Frances Lynch and the Electric Voice Theatre to try and communicate our research to the general public using music and theatre.
So my name is Dr. Laura Hughes. I'm a postdoctoral researcher at King's College London currently, and previously I was at the University of Sussex at Brighton Sussex Medical School doing dementia research and dementia care research. And my experience with music and dementia is I evaluated musician sessions in a community hospital to look at the impact on patients and their engagement and well-being. And I have an occupational background in care as well, which has always involved a lot of music and music therapy. So I have a personal interest in this as well.
I'll go next then. I'm Rebecca Kirkby. I'm from the Forget Me Not Chorus. We are a registered charity that work in care home settings, community settings and hospital settings to bring song, joy to these different settings. So we are across Wales in general. So we have 5 community choruses in total. We work with hundreds of care homes, both in person and online through Zoom settings. And we've just started a hospital project working with dementia in a dementia setting in hospitals and wards in South Wales.
I think Louise has already told you who I am. So my company, the Electric Voice Theatre, we do projects with women in science, and we've been working with Louise and Karen Marshall at Serpell Lab for about 3 years working on this project. So we're very excited about it because it's just about to happen for real in April. So we're really excited. I hope you all come. Yes, and we have a long history of working with people with dementia, both as a choir leader and for myself, and with various other settings for the last 40 years. So
thank you, and again I'd love to say a massive thank you from the two of us for taking the time to join us today. Now, to start off with some statistics about why talking about dementia is so relevant. According to Alzheimer's Research UK, there are estimated to be 944,000 people living with dementia in the UK. So let's maybe start with what dementia is, sort of the characteristics and the current ideas of the causes.
I was wondering if you would like to tell us a bit of what exactly dementia is and how it's sort of the entire pathogenesis of the process. So
my main perspective on Alzheimer's disease and dementia. So first of all, dementia is an umbrella term, and it includes lots of different sorts of dementia, and the most common of which is Alzheimer's disease. We're interested in the causes of Alzheimer's disease, and there are quite a few different theories about what might be causing it. It's not known, but the main thing that's known about it and has been known for the last 120 years is that the pathology of Alzheimer's disease is that there are misfolded proteins that are accumulating in the brain tissue. And so one of the things that we seek to communicate and also work on is trying to understand why that happens. So as many of you will know, there are deposits of amyloid beta and tau proteins in the brain, and they're intrinsically linked to probably to the cause and the progression of disease. So whether or not they are a direct cause or whether they're associated with the progression of disease is not absolutely clear, but that's really what people are trying to understand: what triggers disease, what causes it to progress and lead to the decline in cognition that we see in people with Alzheimer's disease. Does that outline what you needed me to say, or would you like me to say more?
Yeah, no, that definitely gives us like an overview of dementia, or what dementia exactly is. I just had a question because like I remember like reading like a few months back that this might sort of derail from the conversation a bit, but it was just a question that I had that a few months back I remember reading an article which said that like dementia, Alzheimer's as a whole, might not be a disease that like results from protein misfolding, but it might be sort of a symptom, and Alzheimer's as a whole might be an autoimmune disorder. So I was wondering if you could like just talk a bit about that.
So it's unlikely that it's an autoimmune disorder, but there's certainly a lot of research that seems to suggest there's a component of neuro inflammation. So that seems to be a very important part of the progression of disease. It's been shown that proteins that misfold and accumulate in disease do trigger some neuroinflammation, but always with these sorts of conditions in humans that we can't really study directly in humans, it's very difficult to see what's the cause and what's the effect. So what we know for certain is that there are the deposits in disease, that is this accumulation, and that's also the case in many other dementias, so not just Alzheimer's disease, but the thing that really is the similarity between things like Huntington's disease, frontal temporal dementia, and many other diseases is that we have proteins that misfold and accumulate. The neuroinflammation may also be a very important component, and which one happens first is still unclear. So I'm sure that Laura would have perhaps a different perspective on it, but I think it's a really important area to study so that we know what we should target in order to tackle the disease. Does that answer your question, Ray?
Yeah, definitely.
Oh, I could just say one more thing actually related to that, which is that in the last sort of 3 or 4 months, there's been a drug that's been developed which specifically targets the deposition of amyloid proteins in the brain, amyloid beta in the brain, and seems to have been reasonably successful for treating Alzheimer's disease. And that I guess backs up the idea that this could be a useful target and that this is involved in some sort of causation or progression of the disease, because if you can treat it and improve the disease, then it suggests that this may be something that's involved. So it's been a very controversial area of research for the last 20 years or so.
Yeah, definitely. I mean, like with one of the major things that comes with like neurodegenerative conditions, and sort of especially with regards to like dementia and associated conditions such as you mentioned, like frontotemporal dementia and Huntington's and Alzheimer's, is that the sort of molecular processes and pathways, they're like so interconnected to each other that it's really hard to like sort of pinpoint a particular reason or a cause as to like how things might happen, and it's more of like a cascade of things that get triggered from like a single event, if my understanding is correct.
Yes, although it might be triggered by different events that lead to the same
Yeah.
disease. Yes, so you might trigger the same cascade but using different triggers.
I was wondering if Laura, you could shed a bit of light on the symptoms that that are usually observed in dementia, people with dementia, and sort of maybe the diagnostic procedures a bit.
Yeah, certainly. Can you hear me okay? Yeah. Just my microphone sometimes go funny. Yeah. So yeah, so the symptoms within dementia do vary among people, and there are quite a few different symptoms. But generally, we see things such as memory loss, difficulty concentrating, difficulties in problem solving, changes to language or language problems, confusion and mood changes in people. So it's very individualistic how it can present in people, depending as well on the type of dementia that somebody is diagnosed with. The diagnosis process itself is not straightforward either. There's no single test for dementia to diagnose any of the dementias. It's a series of processes. The usual process that people go through is that they present to their GP with a concern. Usually it's things such as forgetfulness, so it's forgetting things that they're doing, forgetting people's names, or confusion. So people will normally present to their GP, they'll do some initial tests, some initial cognitive testing, and also test to make sure that there's no other underlying medical cause which could cause these symptoms, because memory loss itself is not the only thing related to dementia. It could be lots of other things going on, such as urinary tract infections, particularly in older adults. If the GP suspects that there's possible dementia, they can then get referred on to, for example, memory assessment service, or a geriatrician, old age psychiatrist, those sorts of healthcare professionals, who will then again run a series of tests and potentially do a brain scan as well, so an MRI scan. Not everybody will get that, depends on what happens or what the outcome is of their cognitive testing, but there's no one single test that will determine whether or not somebody has a dementia. It's a series of tests that will paint a bigger picture of whether or not somebody will get a diagnosis of dementia.
So what my general understanding from it was that with respect to the diagnostic procedures of dementia, since there are like a variety of symptoms that can be observed in the patient, starting with cognitive decline to general loss of memory, there isn't like a singular test that can sort of narrow down exactly like whether a person might have dementia. So it's more like a list of tests which can turn into like, which can sort of start from like ruling out various other conditions. Because I was seeing like I was reading one of those things where like a lot of times like people with Alzheimer's might get diagnosed with maybe like Huntington's, or depending on like the symptoms and the similarities of the symptoms. So it's sort of a list of tests to like rule out various conditions, if I'm not.
Yeah, that's pretty much it. Yeah, so all of the different symptoms of dementia could be explained by other conditions, which you basically have to rule out. And there'll be a series of tests. So the testing you were talking there, so the different cognitive tests will test different aspects of cognition. So it will test executive function, it'll test language, those sorts of things to see where there's deficits within that individual. And usually things such as ruling out other medical problems will be done in the first instance with your GP, or it should be done anyways. Yeah.
With respect to the symptoms of dementia, one of the symptoms that is listed is sort of like depression and increasing sort of sense of isolation, because dementia as a whole can sort of be an incredibly isolating disease condition. And with a condition, it's not simply about memory loss, it's also more about like the loss of identity of the person. So I was wondering if all of you could sort of just shed a bit more light on like what the relation between like someone's memory and their identity and dementia might be, and what might be sort of like the general considerations into like that need to be taken into consideration in terms of like dementia care, and then thinking about like patient well-being and how we can like improve their quality of life and various things that are involved in that.
I can start off if that's all right. So I suppose the thing to think about is what makes you you? So what is your self-identity? You know, what makes you have your own identity of yourself? It's your likes, your dislikes, your hobbies that makes up you as an individual person. And when you have dementia, particularly if you have memory problems, you may lose the ability to take part in some of your hobbies and interests that you have previously held. And something that could be, you know, an absolutely central part of you being you, and how you present yourself to the world. And if that starts to get changed because of dementia, that can have a significant impact on your own self-identity, but also on how others perceive you as well, as a person with dementia, so that you can see a change, for instance, in a family member that no longer does what they used to do before, whether it is these different hobbies and activities or different interests that they have. So I think that can be quite a shocking thing to see from some people, and then that it leads to this idea of losing people when they have dementia, or we've lost that person, or they've disappeared, which isn't true. They may change, and they may change their likes, their interests, or their abilities to do things, but the person is still there inside. So I think it's just interesting to understand that kind of context of, you know, what makes you you, what is your self-identity, and how that can be changed. I suppose I don't like to use the word eroded in this context, but I suppose how this can be changed because of memory impairments and changes because of dementia.
I wanted to ask Rebecca a question. Since you sort of your work with Forget Me Not Chorus mostly focuses on like working with people with dementia and sort of providing them with music therapy, and I just wanted to ask, like, what exactly, like, the kind of like how do I phrase it, what sort of like behavioral aspects that you might observe in people with dementia, and like how over the time it might change while delivering them like with music therapy. And so yeah, I just sort of wanted to ask that.
No, that's absolutely fine. So one thing I should probably say is Forget Me Not Chorus, even though we're a registered charity, we're not music therapists. So we work as freelance musicians who go into these care home settings, these hospitals, these community settings, to work from a point of view of music is meant to be enjoyed. It's not a therapy setting. It's something for everyone to enjoy, including the people living with dementia, as well as their carers and their loved ones and their family members. But you're right, I see people who have just been diagnosed with dementia all the way through to people who have advanced dementia in all the different settings that I work with. And it's quite astounding, the difference and how it can all progress quite quickly from the moment of diagnosis. What we find is a lot of people who have early onset dementia, who are diagnosed quite early, will retain all of their personality traits, their individual identity for a number of months, but in the settings that I see them in. But it can take 1 week where we won't see them for 1 week, and it will be like the click of a finger, it will just start going downhill, and they'll start forgetting what they like doing, their interests. They might get a bit more confused, and with confusion it can be frustrating, because in some cases they know that they're confused, but they don't know what they're confused about. So they can get sometimes frustrated with that, and they can get anywhere from quiet, where they just refuse to talk about it, and they become very closed and isolated from their loved ones, as well as the settings that they're in, or from us, or they might lash out and they might become a bit more aggressive or violent, or a bit more vocal about their frustrations. Some people will take their diagnosis, or they'll take specific facts about themselves, and to help them remember it, they will just say that over and over and over again, whereas some people will just ignore the fact that they've been diagnosed with dementia, because they are so terrified that it will affect them as a fundamental person, and they won't be able to contribute to society because they've been diagnosed with this. So it's there's a lot of different things, and this ranges from people who have just been diagnosed with early onset dementia to people who are in care home settings who are full-time care. unfortunately. Some of the people that I see in the choirs, so in the community choir that I run on a Saturday, they've got severe dementia, but they because they've got a really good support group and family members who care for them, they haven't been put into a care home yet. Whereas I've seen some care homes with people who have early onset dementia, but they progressed so quickly, where I've seen them in choir 1 week and a month later they are in a care home because they can't they can't function properly anymore. So if you don't mind me giving an example, there was a woman when we started the choirs who came along every week, and she was a pianist, a professional pianist. She'd done concerts all over the world, and she at the beginning was able to play all sorts of pieces when we first met her. She was in the choir for about a month, I think it was, and the progression from early onset dementia to quite advanced dementia happened within about 2 weeks, where she started losing these of her fingers and she wasn't able to play on the piano anymore and ended up in a care home setting instead. And it was so quick the way it came on. It was quick, and it can be heartbreaking to watch, especially for loved ones and the carers, which is why we do these community settings as well as the care home settings, to give that sense of joy to everyone involved, not just people living with dementia. So yeah, I don't know if that answers the question or not, but I hope it does.
Yeah, no, that definitely answers the question, and that also like sort of tells us about like how the changes that can take place in people with dementia and these associated conditions, they can be quite unpredictable, and like one moment they might seem to retain their personality, and they might seem to like they have their memories and their identity intact, but at the same time, like in like sort of a span of few weeks, as you said, like a person might completely change.
Yeah.
And the change might be quite drastic. Another question that I sort of wanted to ask, and honestly anyone's free to chime in and answer the question, is that over the last few years with the pandemic, all of us have been sort of like forced to be confined in our homes, and so the engagement into like various activities has been quite limited for a lot of us. And with people with dementia being a condition which is quite isolating, I was wondering like how what impact would that have on the person's well-being as a whole?
I'm happy to go first, if that's okay. Yeah.
Sure.
So due to the pandemic, as we know, dementia is, as an umbrella term, is such an isolating condition to live with in general. It's horrible, especially when you're that much more vulnerable and you're told you have to stay isolated and stay inside and everything. It's quite difficult to lose contact with your friends, lose contact with your family, because your family might not live near you, so they might not be able to visit you that easily. And it can be quite detrimental. And I have a feeling, I wouldn't know for sure, but I have a feeling that it probably would have caused a very big decrease in personality and individual identity if it was that isolating and you were forced to isolate yourself due to a pandemic. For the Forget Me Not chorus, I know that we jumped on it pretty much as soon as we got told everything's closing, and we opened up a Zoom choir that we did once a week, every Thursday without fail, which meant that you were able to go to care homes and do singing, even though you weren't physically there, and you could also join online from your home as well. So there was that sense of you could build a community doing things online, but a lot of people who do have dementia possibly do not have the capabilities to get online in the first place. So that's another factor that you have to think of as well. So yeah.
Add to that and give a slight alternative view as well. I've been doing some wider aging research at the moment and speaking to people about the impact of COVID as well. And I think there has been a negative impact for a lot of people because of COVID and isolation, but I think as well there's the surge in technology use in things such as Zoom and Teams, and the ability then of organizations and individuals to offer up these online alternatives for people to engage and communicate, I think has been phenomenal. And I think a lot of people have actually benefited from that. And I think we very often look at older people and people with dementia as well and think, oh, well, you know, they probably can't use these sort of technologies, but they absolutely can, particularly if they have the support as well from family or even somebody talking them through the steps of how to use different technologies. So I think that, yes, absolutely, people have, you know, been significantly impacted negatively, and it's had that impact on, you know, isolating them and really reducing their quality of life and their well-being. But I think on the flip side of that, it's actually helped a lot of people as well and opened up their world a bit more and allowed them to connect with their family a bit more, even during COVID, and also with other people with dementia as well. So I think it's, again, it opens up those opportunities for us to enhance this kind of digital communication and engagement with people as well.
If I could add to that, I just to say that I think you're right about this digital thing making a big difference. We certainly ran a virtual choir, which allowed lots of people in isolation during the pandemic to come, and we still do it. So we're able to have some people with dementia coming in from care homes and things like that. We're supported, and it's definitely made a massive difference. And we find, and in support of what Laura said about older people being able to use and people with dementia being able to use the technology, they absolutely can. In fact, very often they'll tell me off for not doing something correctly, excuse me. so you know, I think it's a really good thing. And I think my worry slightly was that people were going to drop doing those things online because they could do them in person. And actually what we've found is that, I mean, certainly from a singing point of view, there's lots of people who don't want to be in the same room as other people in order to sing because they feel embarrassed about it, or their condition makes them feel embarrassed to be, you know, out or whatever it is. And it's just such a fantastic thing for them to be able to do online. I think it's something, I hope that everybody will keep that going. I'm not sure, Rebecca, from what you were saying, but I imagine you're still doing that.
Yeah, we are. So we do it every Thursday without fail. We've been doing it for 2.5, 3 years now, since the beginning of the pandemic, and I think we're reaching over 1,000 care homes, and that's not to mention that's 1,000 care homes in the UK. That doesn't include care homes abroad and internationally as well. And we see them in single homes and everything as well. And don't get me wrong, I completely agree. I think especially with the pandemic, technology advances have just zoomed ahead. It's literally zoomed ahead. Everyone uses Zoom nowadays.
Yeah.
And that's how I don't know about the electric voice theatre, but that's how we do it. We do it through Zoom. Is it through Zoom for you guys as well?
Yes, well, we do both. So, you know, we work with people in both ways, but we found that the Zoom thing is very, very important.
So popular. It's also, it really helps that there's a mute button. So if you don't want people to hear you sing, you can put the mute button on. It's really helpful.
Exactly. People love that. They love the fact that they can look like they're singing. So don't necessarily, you'd never know. That's the whole point. Could I ask, sorry to Ray, but could I ask Laura and Rebecca a question about, because you've both been talking about identity and all these things and how things go down. My main experience with people with dementia, my longest experience, is with people living with Down syndrome. And what I see, I mean, this could just be my personal experience, and I may not be right in thinking this, but what I see is a very different thing from losses of identity. And I'm wondering whether it's because Down syndrome people, of course, live by habit. You know, it's almost like a muscle memory that they have, and very often they seem to continue. It only becomes a huge problem if that's interrupted because physically they can't do something, or, you know, then it becomes very confusing. But what I see most when it gets bad is their terror, because it must be. I mean, you know, it's difficult enough, isn't it, as a Down syndrome person sometimes to latch on to what's going on, but when something like this happens, that seems to me, I mean, the word I would use is terror. That's the word I would use, and it's very difficult to comfort someone who's in that phase. But you know, that's just my experience, and I was just interested. You were talking about identity and those things, and you know, that seems to me to be slightly different in a Down syndrome case. I don't know.
That's really interesting, actually, that you bring that up. I think, Yeah, and people, I think, have done a bit of research looking at sort of comparing people with dementia and people with Down syndrome, and people with Down syndrome who end up getting diagnosed with dementia as well. And yeah, I think just that the idea of identity and routine, what you said, is interesting, because that's one of the first things they tell you to do, really, if you're worried about your memory, or if you have dementia, is, you know, keep a routine and put those different things in place. So yeah, that's interesting. Then the different coping mechanisms, perhaps, that the two different groups would have in helping to maintain their identity. Yeah.
Yeah, I have to say, terror is one thing that you do see. You don't see it as often in the settings that I see them in, because a lot of the time I come in and we sing for an hour, for 2 hours, however long it is that I'm in there for, and you get them to sing along, and you get them talking about what they've done that day, what they've done previously, and it's not always the first thing that comes up, but you do have it come up, and when it comes up, it's a serious conversation you have to have with them, because you can't just dismiss it. If they say I'm scared, you can't just dismiss it. You have to have that conversation with them. And I know that in the community chorus, I have that a lot more than in the care home settings that I go into, where they'll be singing, or one of them will just say, oh, I've just been diagnosed, I'm really scared. And the good thing about the community setting is a lot of the people who are there have also just been diagnosed, or have been diagnosed for several months, and know some coping mechanisms, and know how to not work around it as such, but work through what they're going through. And they can talk to them, because in those community settings, for whatever reason, they do have that community sense of remembering what they've been through and being able to help other people.
I think this is an element of the level of insight that people have as well into their own condition at that point. So earlier on in the dementia journey, when people have insight into the impairments that they're starting to see, it is going to be absolutely terrifying and really worrying and upsetting for them. But then as people progress, they might have less insight into the changes that are going through. So therefore there's less worry or terror in that sense. And they've adapted. That's the kind of the position I take with dementia, is that they've kind of adapted their routine or their life to what they're able to then do at that moment in time. So there's less worry around it, I think.
They're even able to make jokes and all sorts about the fact that they have dementia. It gets to that point, they'll start off terrified with that terror that you were talking about, Francis. By 4 or 5 months, 3, 4, 5 months, they will be joking and go, I can't do that, I've got dementia.
Yeah.
I think the terror you're talking about and the one I'm talking about are slightly different.
Possibly.
because I'm talking about people who are unable to grasp what it means to start with.
Yeah, okay.
So it's not, so they're not afraid because of the diagnosis. They generally, I mean, not, I'm being very general here, because of course, obviously there are some, but generally speaking, what I found is that they don't, the terror comes much later down the line, because they can't grasp. You know, I think it's that thing of not having the facility to really grasp why this is happening to you, or you know what's going on. I mean, I think that's what I'm talking about, really. It's much more deep rooted than a kind of intellectual, well, this is I don't want this diagnosis, you know, why have I got it, kind of thing.
It was so definitely like what I would think, like what I sort of understood from the conversation was that dementia, like the diagnosis itself, can be pretty daunting to sort of grapple with, and trying to understand what exactly is happening to you can also be daunting. But at the same time, like as Rebecca said, down the line, after like a couple of months, people might develop a form of like coping mechanism and start joking about it, in like, it's just not exactly to like belittle it, but to sort of maybe like take away the seriousness from it, just to make it a lot less grim. And what I understood from what Francis was talking about is that dementia in its inherent form is a condition that, like, trying to make sense of the world that's around us with like progressive loss of memory might sort of get a bit more challenging. And sort of life can sort of feel quite difficult, if I'm sort of getting the general understanding of what you're trying to say, Francis.
Moving on to the scientific aspect, what's the impact of music and music-related activities on a structural molecular level?
I'm slightly worried that you're asking me that, and I honestly don't know. So it's not an area that I've worked on. So I don't work on people at all. I very much work on understanding what's happening at a cellular level. So we have, if you would like to design an experiment where we look at the effects, that would be very interesting. But I think I think we won't know anything about the effects on a molecular level. It's going to be much more about the behaviour that it helps. And it sounds to me from what Rebecca and Francis have said that the music has a hugely beneficial effect on the people and their general well-being. It sounds, just from both of what you've both said, it sounds incredibly joyful. Your environment of singing along. It seems pretty tempting to join, actually. So I'm afraid I can't add anything about the molecular or cellular effects of music. But I guess if you think about it from a neuroscience point of view, you could think about how different neural pathways are being activated by external stimulus, perhaps.
Yeah. And if we were to design an experiment, what sort of ways would we use to record the impact?
I think, again, this is a psychology experiment.
Okay.
Yeah, and not my area of expertise.
I was reading a bit about like sort of impact of like music therapy on dementia patients, like some of the studies that had been conducted, and what I found is that a lot of these studies pointed towards sort of music memory being essentially different from like other types of memories. So there would be like two types of memory: semantic memory and episodic memory. And semantic memory would adhere more to sort of the facts and the factual information, and episodic memory would be more towards the sort of events that have taken place in life and the experiences of the person. And there was this one fMRI study that I found from 2015, which sort of observed that the damage that was caused in like caudal anterior cingulate cortex and ventral pre-supplementary motor area was significantly less compared to the other areas of the brain. And these are also areas that are involved in neural encoding. And one of the hypotheses that the authors of the paper had was that at that point, the area was fairly well preserved due to sort of reduced amyloid depositions in that area, which was quite interesting. So I was wondering whether like the type of memory encoding that takes place in a certain part of the brain has something to do with the sort of amyloid deposition that occurs in that particular area. If you could sort of shed a bit of light on that, Louise.
Again, not really. I'm very sorry. I think what we're uncovering here is that as scientists, we become incredibly narrow and focus on a very, very narrow area of research. There are, of course, lots of people at Sussex, actually, who work on fMRI and looking at different areas of the brain and how they're affected, where amyloid fibrils are deposited. It's interesting that you come back to that in that case, it suggests that the authors of that paper really believed that amyloid deposition was intrinsically linked to deficits in that particular area of the brain. So that's quite interesting to me that you've mentioned that. But I think in terms of where the protein deposits are collected, I don't know that there's a very strong link. I mean, we know that the main area that's that's affected by pathology, at least to start with, is the hippocampus, which is obviously the area linked to memory. And we do see deposition in the entorhinal cortex, which is linked to the sense of smell. But beyond that, I don't know that there's a very clear link between areas of the brain and the deposits and where we start to see deficits. But there may well be, and it's not my area of expertise, I'm afraid. But it's a really interesting study that you found. Really nice. But I think the fact you only found one is interesting too. That
no, I mean there were others. There were others. I just sort of like thought this one was the one that I could point out. So yeah, but there are quite a few studies that I found that discussed sort of like the changes in the brain that sort of take place with respect to like dementia, and there were like quite a few studies talking about how like music memory is essentially preserved in like patients with dementia, or especially Alzheimer's, or even like different types of brain lesions compared to like other memories that might form. And it was quite an interesting thing to me that like specifically music memory would be preserved while other sort of factual memories might be lost. And that would sort of bring me to my next point of discussion, would be that music memory has also been like extremely linked to emotions and sort of helps in evoking a sense of reminiscence in a lot of patients with dementia. And I was wondering if that was something that Rebecca, you or Francis, you or Laura, you guys observed while working with people with dementia. Like, does familiar music sort of like trigger certain emotions or activity in people with dementia?
Yeah, I can speak first if that's all right. So coming back to this idea, which you mentioned a few times, Ray, of the different types of memories, so these episodic and semantic memories and music and emotions, like they are all linked. And I think one of the best things that you could actually do is to go and spend some time with people with dementia when they're listening to music, and you'll see the impact that it can have. And you would have experienced it yourselves as well, although you might be a little bit too young, but certainly we get to a certain age and you hear music from, you know, your teens or your childhood, it will invoke a time and an emotion at that period of time, which, you know, it could be quite a strong thing that you recall from years and years before. I don't know if any of you have ever done the Dementia Friends sessions that are available through the Alzheimer's Society. They have a really good example of how memory and emotions work with people with dementia, and it's the bookcase analogy. That basically, if you think of your memories and everything about you is on a bookcase, and you start from the bottom and you fill it up all the way up to the top. And then when you get dementia, it means that is when the bookcase becomes shaky and it starts to wobble. And what happens is the memories from the top shelves, which are the newest ones, fall off first. So we maintain those older memories. So that's a really important point to remember and to think of. But the other important point that they really focus on is the fact that the emotions are still there. And people, even somebody with severe dementia, if they don't remember something that has happened to them the day previously, they're going to remember the emotional response they had to whatever happened to them. So if somebody was horrible to them, they will remember that feeling that they had, not necessarily the thing that happened. And similarly, if it's a happy thing that happened as well. So this link between memories and emotions then with music, you know, it invokes such strong feelings, particularly from years previous, that you can see it in people when people with dementia listen to music. And I, to give an example, have worked with lots of people with varying severities of dementia. And I have worked with one particular lady many years ago who was, you know, pretty much nonverbal, didn't speak to anybody, and just walked around the care home all day, every day, and didn't really communicate with anybody. Put music on and she would sing every lyric to that song, even though she couldn't remember her children's names, those kind of things. That, you know, music brought something else out into her. So it's a fantastic thing to just observe in somebody. And I think one of the, I suppose, inherent problems with music dementia research perhaps is that we look at music and go, well, of course it helps. Of course it helps people. Of course it's good. So we may not be asking some of the right questions at the right times in relation to, well, what can we do with music and dementia in terms of research? So yeah, so sorry, I monopolized that bit there, but yeah, Frances and Rebecca will probably attest to the emotional responses you can get from people when you play music or get them to sing.
Yeah, absolutely, Laura. I mean, I'm sure Rebecca has hundreds of these, the kind of examples that you've just given. I mean, I think that's the most incredible thing when you see that working and you feel that the person, that's brought out a part of that person's identity, really, that they haven't lost. You know, it kind of, and I find, I think that the most wonderful thing about it is the response that their carers or family have to that moment. I think that's the most wonderful thing, because it gives them, I think it makes everyone feel better. It's not, you know, it's just not just because of the music, but because the person has done something which they recognize in them, or in the case of the carers, that they kind of, their jaws go on the floor and they go, but she's not said anything before. What's going on here? You know, so I think it's a wonderful thing. Yeah.
I completely agree. The amount of times where we've been singing a song and there's been this one particular so we refer to everyone who joins in with Forget Me Not Chorus as singers, because we find it's a nice inclusive term for everyone, where one singer who hasn't been singing from the majority of the sessions will either start singing or start doing some sort of movement or make some sort of first contact with a carer, with myself, with one of the other singers. And it's just brilliant to watch, because it really does show that they're still themselves. They're still who they are. There was one, again, if I can give an example, there was one time that I was in a care home and I was singing a song, and I'd done this song with this care home loads of times before, at least 5 or 6 sessions each time. And on the 6th session, I was in there, and the singer had been in the session since the beginning. And as I was going out, the singer grabbed my hand and fully said, "You made me cry during that last song, because I thought of a memory that I haven't thought about in nearly 30 years. So thank you." And it was a happy emotion. It was a happy, receptive, "I'm so happy that you've made me remember this. So thank you so much." And it was, you know, when you have a heart-stirring moment where it pulls and you go, this is the reason why I do this. This is why I want to do this and work in this setting, because it's those moments where seeing them convey that emotion in ways that they haven't done in however many years or however many months or however many weeks, it's really rewarding to see it happen. And I'm sure Frances will definitely agree with me on that, and if Laura's seen it happen, I'm sure Laura will agree as well. So yeah,
it is an amazing thing, isn't it? I kind of wanted to ask you both, because one of the other experiences I've had, because I'm a composer, is actually working with people with dementia to get them to write their own songs. And that what's really interesting about that for me is that what I see is they will remember them because it's coming from them, I suppose. It's something, it's either an emotional response or something that comes out of them, and they might just sing something without any words, or they might sing something with words, and I try to simply replicate it. And I find that really useful, because then I think you're finding things which aren't from a particular song that you're giving them, it's something they're giving you, and that somehow feels really important as well.
So if I'm completely honest, we don't, so Forget Me Not Chorus, we do choir songs, so we don't do any of the composing side of things with the songwriting and stuff, but I have read up on how songwriting and poetry and stuff like that can really help with dementia. I completely agree, it's an amazing activity to do to help stimulate the brain, stimulate the mind, and stimulate their own emotions as well. I completely agree. But on this, I'm just going to pick up on something you said about using lyrics without and versus not using lyrics. Forget Me Not's chorus don't use lyrics. We completely do not use lyrics in our choir sessions or in our care home sessions or hospital settings at all, because we find that the use of lyrics and having so many pieces of paper that they have to rifle through can actually cause confusion to get a bit worse, basically, and it can cause that frustration, it can cause that feeling that they might feel on a bit of a daily basis, and we don't want that feeling in the sessions. So we choose music specifically that is easy to learn by ear and listening, And it's not just the choristers, the singers that don't use lyrics and music during the sessions, it's the choir leaders, the music leaders as well. So it's an inclusive community feel that everyone's learning at the same time. And we've found that a lot of our singers tend to retain those lyrics and those songs to the week after. So even though they'll come in and say, oh, I don't really remember what we did, we'll go over the song once and they'll pick it up in no time. And I think it's just amazing that I think it's just really nice that you said the whole writing the songs and they'll remember it with or without the words anyway. I completely see that every single week. I agree.
Yes, I mean, that's the approach we take. We don't give out. To be honest, I mean, we work with a lot of people who don't have dementia. I never give people word sheets. It's a disaster because all they do is look at them. What use is that?
Or the crinkling of the paper can get quite frustrating sometimes.
If you want to talk about folding or misfolding, you can get them to fold it up and chuck it around. But apart from that.
Sorry, Rebecca, you said that you're not a music therapist, you're a musician, and Frances, I'm assuming you're the same. Is that correct? Yeah. I've worked with musicians as well. So obviously you can have music therapists who are trained therapists and who will use music and the tools obviously that they have learned to get people to to open up or talk or for whatever the purpose is of that actual music therapy. And I as well have worked with they're professional musicians who have been trained to work in healthcare settings. And I think there's a place for both of these different sort of ways of working with music with people with dementia, because they still both evoke that emotional response. And I as well have seen that in the research project I did in a hospital ward that, there was a gentleman who he just started to cry. And when he was approached by staff to see if he was okay, he just said, no, it was like a release. And he's like, this just brought back memories and kind of made him reflect on his time in hospital, that kind of thing. And that wasn't through music therapy, that was just through music itself. So it's just an interesting kind of difference between music therapists and musicians who work in those healthcare settings. They both still work.
By the way, Frances, thank you for bringing up the point of people with dementia actively engaging in songwriting and the process of creating a song, because that was exactly my next question that I wanted to ask. Is that I was wondering, as you mentioned, that people would often sort of remember the lyrics that they actively engaged in sort of creating and an activity that they actively participated in. So I was wondering if that would sort of be the result. It's sort of a very general hypothesis, but I was wondering if that would be the result of sort of increased plasticity within the neural connections of the brain. As a result of active participation and doing something again and again, which would sort of maybe improve the condition of the neural circuitry, thus sort of attempting to bring back some of the memories that they might have lost.
I'm not sure if any of us are in a position to answer that, unfortunately. I think the only thing that I can see on that is that we do know that people with memory problems can learn new tasks. So we do know that. So obviously people, and as Frances and Rebecca have said, people with dementia can learn and remember music that they've made or things that they've created. And I suppose that coming back to identity and things like that's I think quite an important aspect of thinking about people with dementia and people with dementia in care, and about allowing people with dementia to have the ability to create and to make things themselves for their own well-being, their own quality of life. I can't talk about brain structures and plasticity, unfortunately, but I think in terms of behaviour and care, it's certainly an important aspect of people's well-being, is allowing them to be productive and to express themselves, and to be given the ability to learn, and not having this view that, well, once you've got dementia, you've got memory problems, that's it, you can't do anything new.
Just to kind of add to that, so again, from the experience that I've had with the Forget Me Not chorus, it's great if the singers that we have, the choristers that we have, do remember a memory that they've forgotten, and something evokes that and brings it back to them. But we don't set out to allow them to reminisce. I don't know if that makes sense or not. We don't set out to bring those memories back. What we're trying to do is we're trying to use the entire the entire experience as a tool to sorry, my brain's gone completely fuzzy, 1 second. We use it as a tool for in the moment. It's a communication tool that they can use between themselves at that point in time. If they have a reminiscent memory of something, then that is great. It's an amazing thing to see, because it's a breakthrough that we have, but we don't choose our music or choose our lyrics based around trying to evoke memories and trying to get them to have some sort of reminiscent time. We do it as we're going to do a fun song, and we're going to do some movement, because Laura and Louise will probably agree that with dementia, sometimes you can lose different functions of your body, because it's just so debilitating sometimes. So we use movements in our songs more than anything else to try and help keep people active and keep people fit. And we find that sometimes helps with all sorts, basically. It helps with the enjoyment, brings very happy moods. It's an endorphin. It creates endorphins. It makes them a bit more ready to have a bit of fun, if that makes sense. But we don't set out to try and get them to have some sort of, we don't set out to make them aware of their memory loss. We set out to make them aware that they can still contribute to society and have a good time in the present time, no matter what's happening to them at home, kind of thing.
Just to add on to that, I think reminiscence therapy or reminiscence sessions are very specific, and they do target, either with objects or music or anything really, to try and get people to go back to a certain time and have discussions around that. Obviously, in terms of trying to invoke certain memories from people through music, I've never met musicians that do that kind of specifically. It's more, like you said, about being in the moment and encouraging that engagement with people and between groups of people as well. And that's something that I found in the research that I did. So it was music sessions in hospital wards, and I observed people before, during and after these using an observation method called dementia care mapping. And that's what we saw. So Rebecca, you mentioned there about communication, so enhancing communication with people. Like, there was an increase during and maintained afterwards, where people would start to actually talk more amongst themselves in the ward after the music session, because it just, it perked people up, it made them happy, it inspired them to do something apart from sitting in their hospital bed or their hospital chair staring at the TV or at the walls. So I think in terms of, I think that's the best part about music, is it just gets people just doing something, and it kind of inspires them. Maybe not necessarily to invoke memories. That might happen. I've certainly not researched that. But I think, just like you said, Rebecca, being in the moment is a fundamental aspect of it, I think.
It also gives them something to talk about afterwards. If they found a specific thing in part of one of the sessions quite funny, they go, "Oh, wasn't that quite funny when we did that?" And it's just a community feel thing, really.
Yeah, and it might inspire people. You might have two people who say, "Oh, I remember when going dancing to this song, for instance, when I was younger." That might happen. They might start to talk about their life history in that respect.
Yeah, they do. They do in the sessions that I see. I don't know about you, Francis, but they do in the sessions that I tend to do. Yeah.
Yeah, no, absolutely. So that's a that's a given, isn't it?
Yeah, pretty much.
Are there any other artistic interventions that can help engage people with dementia?
Do you mean other than music?
Yes.
Yeah, absolutely.
I'd say so.
I'm sure Laura and everybody would agree. Yes, just about any artistic intervention of any kind, any artistic session where people are working on something and doing something together, particularly I think when they're doing something together, but not just that. It can be really, really good.
Yeah. I think just anything where you have to think outside the box and be a bit more creative can just allow that free thought and free thinking. So music is great in that sense, but you can have art, you can have designing, you can have poetry, you can have dance. Dance is a big one as well, actually, like movement sessions, and dance is quite a big one.
I know certainly when I worked in care homes, if I had any residents that were anxious, because I did it myself, mandala colouring, so it's sort of like patterned colouring. I started to give those out to people if they were had any sort of anxiety or were worried about anything, and that seemed to work. It was expressionful for them, but they could do it quietly by themselves if they wanted to, or you could have people doing things together as a group and talking about what they're doing. So it's, yeah, I think there's a lot of different things that people can do. And I suppose if you think about what we would, as healthy able-bodied people, what would we like to do to express ourselves? People with dementia can do the exact same, and it might have to be done in a slightly different format. They might have a slightly different reaction to that process, but it's certainly something that would work for them.
Yeah, I think that's a very good point, Laura, is that really what we're talking about are things that work for everybody. No matter who they are, whether they're with dementia or whatever, they're just healthy. I don't know if I'd describe myself as healthy particularly, but I know what you mean.
Any person with any kind of condition, I suppose, can benefit from these artistic, creative pursuits. Yeah.
And I also wanted to ask if music can be used as a medium to make scientific research more accessible to the public.
I think so. Sorry, Louise. I'll just very quickly. I have done some training. I'm actually at something next week about working with creative industries as scientists. So yeah, how we engage with the public. We don't have to do it just through journals, presentations, the really dry, boring stuff that we usually do. You can absolutely have really expressionful ways of disseminating and showing, culture and, I think so, ampersand, the sign ampersand, culture ampersand. If you look up them, they're really interesting. They've done a lot of work with researchers, and you're talking like really hard bench science and social science, and they've used plays, music, sculptures, all these different ways of expressing and showing the findings of research. And I think it's absolutely fantastic. I've heard of classical musicians who have been given data from a research project, and they've created a piece of music out of that to then play to audiences, so it's a bit more accessible for people. So yeah, and I think it's a fantastic thing to do. So, sorry.
No, it's lovely to hear your perspective on it, because I would say it was an experiment. From my perspective, it was an experiment, not from Frances's, because she's done it lots of times before, but working together to try and to communicate something that I think sometimes I find quite difficult to put into words and explain to the general public. What we've done in the work that we've done with electric voice theatre, I think does communicate not just some of the information, but also some of the feelings about the work that we've done. And so I'm going to let Frances say a bit more about how it works, because if you'd asked me a couple of years ago, I would have said, oh, I don't know how that would work, but now I think I understand it a bit better. So.
But Louise, you had to, I think one of the things that you said was that the interesting thing for you is that you had to, because you had to talk to me, I know nothing about it, and you had to explain to me what it meant, and that sort of changed over the years, what you said about it. It was quite interesting when we made a podcast a few weeks ago. And Louise came out with I said, oh, can you give us a really concise explanation of it? And she just came out with it on the top of her head, and it was perfect. It was I just used that because there was no editing involved. It was really clear and everything. And I think and it wasn't because I knew by that time a bit more about it. It was much more that I think we'd kind of developed between us a kind of understanding of how that sort of level of the communication work, because that's got to work first. If that doesn't work, if you can't explain it to me, I can't explain it to them, can I? It's that sort of thing. It's getting that understanding. But certainly, Laura, you mentioned you know, that people have given data. So this is something that I've done a lot. And I think one of the most interesting outcomes was when we were, I was working, it wasn't a piece that I wrote, it was a piece that one of our commissioned composers wrote about DNA. And it was a researcher who'd been working on a particular problem in kidney disease, and she said that she heard, because basically she just translated the code into sound, and the researcher said that she heard in the sound something she hadn't seen when she was looking at her research. And I found that really interesting, because of course that's another important skill, isn't it? Another important communication is that the scientists really have to get something back from it. I think that's really important too. I mean, we were commissioned to specifically in this case to create something for the public to consume. And there were 3 other composers from the university who created pieces as well. So it's been quite an interesting kind of journey. And I think certainly, I mean, my entire company's work is now communicating the science of women from the past and the present, and how they, you know, how that sort of, that building of heritage from within science and within geographical regions, you know, who can you use as a role model? It's quite an important thing. But I think the data thing is really interesting to me. I mean, I've built all sorts of data out of pieces out of environmental data about, you know, planting on mountains and things like that. So people studying, you know, the receding snow line and things like that. I mean, all sorts of things, and it's really fascinating. I'm not sure the data pieces always manage to communicate to the audience the science. They communicate something, I don't know what. So I tend to be a bit more didactic, I think you would say, Louise, wouldn't you?
So what you're saying is that it can sort of help decode the data.
Yeah.
I feel like a lot of times, like for us, like as like students who study science and even like scientists, we are sort of introduced to reading research papers and various data and sort of interpreting them. So we sort of have the habit of doing that. But even for like, but for like general public, it might sort of be a daunting task, because not everyone would be able to understand a lot of the data that's presented in a scientific paper. And also, I've observed that scientists have this funny habit of using overly complicated words when they could just use simple terms even in like abstracts, which are supposed to be a simplification of the entire paper. So I feel like using music as a way to sort of communicate like the knowledge that is contained in those research papers and the experiments is extremely sort of like helpful, especially in terms of various conditions that can affect people in real time, and sort of give them a better understanding of what the condition might be and how exactly it progresses.
I'm interested, Ray, that you say that the students of the subjects have to have the dry papers. But actually, Louise, I think you mentioned once that it would be great if I came and gave my lecture, in inverted commas, about misfolding to your students as a starter for 10.
Yeah, I might actually just play it instead of giving the lecture for the 3rd years. So you might get to benefit from that. No, I think it's a fun way of communicating, and it works really well. It probably couldn't completely replace some of the detail that you all need to know for your undergraduate degree, but it's certainly a nice icebreaker in the start, definitely.
It's a nice addition. It's like adding qualitative to quantitative data. You're giving a bit more meaning behind something. And I think it was Louise, I think as you mentioned, the feeling of something. So you can have a bit of research that you think, this is really interesting, and this, does or doesn't answer our hypothesis, and then an arty person comes along and provides a bit of emotion or feeling to that, that can then just take it to a whole other level and make it way more accessible to the general public.
Yeah.
And not dry.
Yes.
Well, we hope not, Laura.
I'm sure it's not.
Well, you'll all have to come and see it. It's going to be on at Brighton Phoenix Art Gallery from the 19th to the 23rd of April.
I think I'll have to come along.
Just quickly jump in with something that you guys were talking about earlier about the whole music in the brain and the different areas where memory can overlap and how that can help change things. So I'm relatively new to the Forget Me Not chorus. I've only been working with the charity for about 1.5 years. So when Ray and Fatma and the others asked me to join the panel, I very much emailed my my boss Kate Wolveridge in a panic, going, "What do I talk about? How do I do this?" And I didn't think that we'd talk about much about the music in the brain and stuff, but she did give me some information that I thought might be quite useful. So she did say that with the regions of the brain associated with musical memory can overlap with areas that are spared in Alzheimer's disease. And I think Laura and Louise mentioned this before, but we found as well, it's a very strange thing that someone who starts playing a musical instrument later on in life is it's associated with a lowered likelihood of actually developing dementia in the first place. It's something about using the brain and using that musical memory at a later stage in life before it sets in, basically, to start working the brain. It's a mental and a brain stimulation. And it's classed, I guess, as a music-based intervention more than a therapy or anything, because it's something that you're giving to yourself, and it's not a therapy. It's not a therapy, but it's got the potential to lower the likelihood of dementia. It's got the likelihood of to help minimize BPSD, anxiety and depression, anything that people see as a negative disorder. Even when they're not, it's a totally normal part of life for some people. Music-based interventions can help decrease those and decrease the likelihood of those actually developing in the first place. It sounds like a really silly thing, but the whole thing about the instruments I thought was particularly interesting, because that's not just singing. They do mean like a violin or a piano or a wind instrument or something. So just thought I might put that out there, see what you guys think about it.
Yeah, no, it's definitely quite an interesting point that you mentioned that, like, as you said, like, practicing various instruments or just engaging with music as a whole or later in life can reduce the likelihood of developing dementia and depression in some cases. It's also one of the things that I've observed with like other art forms, that like a lot of art forms can sort of act as a way to sort of channel a lot of feelings and emotions that might be built up as a result of like depression and anxiety, not just in general public, but even in people with dementia who might sort of have that sort of their pent-up feelings or frustration surrounding the situation. Music or any other artistic activity sort of can act as an amazing way of channeling that emotion into healthy ways and sort of provide a sort of area where they can like engage with, and as you guys were mentioning, make them feel like they can engage in normal activities like any other person, not just be limited by their circumstances.
I wanted to just say thank you to Rebecca for mentioning about the instruments later in life, as my sister's just taken up playing the piano. So it makes me feel very confident that she'll be all right.
I have to admit, I was quite interested. So I do Forget Me Nots as a freelance. It's part-time freelance thing. My main job is I'm a music teacher as well. So I teach piano and singing as well outside of Forget Me Not chorus, and I have quite a few adult students, and I did not know about this until I spoke to Kate Wolveridge about it, and I was just like, oh, that's quite nice to know actually, that it's literally never too late to start learning an instrument, ever, apparently. So I just thought it was nice. I do want to just kind of jump in about the future of music and dementia research from someone who's not a scientist and has not been involved in any research projects. It can be from a from the consideration of the actual participants and the choruses, if we were doing this from a Forget Me Not chorus point of view, it can be quite a tricky thing doing some sort of research to do with it, because I don't know, say for example, the research is trying to do a brain scan on specific levels or specific hormonal levels, for example, after they've done singing. So Forget Me Not Chorus has recently been offered a project to do this, where after a choir session, the choruses will be asked to go and do a brain scan to measure their hormone levels, measure the different brain activities that's going on, so they can get some sort of, I'm not sure if it's quantitative or qualitative data, it's one of the two, but so they can get some sort of data to try and refine it and give this is what singing does, and this is how it can be maintained. This is what happens after they've been singing, basically. But for our charity, for example, that basically negates the entire purpose of the charity, the idea of doing this amazing, joyful singing, having this community feeling, blah, 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 and then having to go into a very sterile setting where you have to go in for a brain scan and be hooked up to a machine of some sort, and all that jazz can really take away from that feeling of contentment and enjoyment. And one of the perks of the Forget Me Not chorus is that those happy feelings, or what we hope are happy feelings, stay with you for hours or days afterwards until the next session. Whereas we found that the interruption by hooking up to a machine of some sort can actually stop that effect, which means that we're not fulfilling the purpose of the charity itself. So I do agree that music and research into how music can help people is really important, but it's trying to get around that little doing it without like any negative consequences, if that makes sense. It's a really tricky thing to do. So yeah, just from someone who's not a scientist.
Yeah, I think like aside from like taking away from the actual impact that music might have or does have on the dementia person with dementia after a particular session, and how like a study might take away from it, another tricky thing would be to sort of ask for consent to a person who has dementia, because I don't think that they are exactly in a proper position to give consent to a study, consider a study being conducted on them, considering that they have dementia and they tend to forget things and parts of their lives. So I'm not able to properly elaborate on this. I suppose, Laura, if you could elaborate a bit more on this.
Yeah, so people with dementia, even people with severe dementia who lack capacity, can take part in research. You just have to put some extra steps in place for them to be able to do so. You can get ethical approval for any of these. Obviously, if you're wanting to do something quite invasive, such as MRI scans, taking blood, those kind of things, that's a bit of a trickier situation, and you have to really ensure that the person that is involved in your research has consented or has not shown dissent. So some of the ways that you have to presume that everybody has capacity until assessed otherwise. Then you have to assess the person's capacity to make the decision to take part in research. If they have capacity, they can obviously take part if they consent. If they don't have capacity, you have to get a representative, so either a personal or a professional consultee, that is somebody who knows a person with dementia and who will be able to make a judgment about whether or not that person would have wanted to take part if they were able to express that they wanted to take part, if you get what I mean. And the reason that we, I'm going to say, allow people with severe dementia to take part in research is, why should they not take part? They're members of society, and we need to understand their experiences, and we need to understand what it's like to live with severe dementia, and we need to understand lots of other aspects, including biological and chemical processes related to severe dementia. So they absolutely can take part in research, but you would have to weigh up. So what Rebecca is saying, basically, you would have to do less invasive research with some people, so that they understand what's happening to them, that they don't get confused or scared by what's happening. I mean, I've never had an MRI scan, but I've had other scans. They can be scary for most people. So if you have somebody then that has maybe a lack of insight, or they have fluctuating insight into their condition and what's happening around them, that could be absolutely terrifying. So you wouldn't put somebody through that. However, when it comes to other types of music therapy, and even things like testing hormone levels, taking bloods, taking, you know, saliva samples, that kind of thing. That absolutely can be done with people with dementia, and even people with severe dementia. But to come back to what Rebecca was saying, it's, yeah, there's, you need to find the right methods to work with research as a musician, and vice versa as well, to make sure that you're getting the best out of your research and the best out of the music as well. Yeah, hopefully
And
that's
other
clear.
than consent, are there any other ethical considerations in research with dementia patients?
I mean, there's obviously lots of ethical considerations. I think in relation to things like music and these, I suppose, innovative sort of research projects. For me personally, I've always been a bit more skeptical of things such as technology innovation, and whether or not they're being developed for the right purposes. So, for example, you know, anybody could go and develop an app and target it as, you know, this is going to help people with dementia listen to music, and it's going to have, you know, this impact on them. That's a commercial product that people are making, and there's a place for commercial products, absolutely, but I am just worried about people making profit over doing benefit for people with dementia specifically, because they are unfortunately a marketable population when it comes to care. So that's something I kind of, is a very niche thing, but that's something that I consider a very significant ethical consideration.
Well,
Sorry, I think just kind of riding off the back of Laura there. I think also thinking about, like, a massive ethical consideration you have to do is thinking about the safety of everyone involved, and not just the participants of the study, but yourself and anyone else who might be involved. In the terms of dementia, some of the behavioural traits can involve aggression and a bit of violence, and you have to make sure that you're aware of the type of dementia you're dealing with to make sure that you have considered everything. So I think that's a big ethical consideration as well. I might be wrong, but it's something that I've observed in care homes myself. And
yeah. No, absolutely. And yeah, you as a musician going into a care home, you would obviously be aware of your own risks doing that. When you add in a researcher into the mix and ethical approvals through a university, it then becomes a whole bigger thing, quite rightly. Whereas we would have to ensure the safety of the researcher, the staff, the residents, the musicians as well, and take all of those things into account and have processes in place that, should something happen, in what way you'll escalate that with the care home, with the family, you know, with whoever it needs to be escalated with. So yeah, there's lots of ethical considerations to think about, but the main things are definitely consent and safety.
Is there anything else that anyone wanted to add, or can we take questions now?
There was something that I wanted, sorry.
Oh, of course.
There's something right, kind of based on the back of when you guys asked if there are any other artistic therapies that we could use. I was just going to say about how music can be used as different as a intervention for other things other than dementia as well. So I also have a background in working with cancer patients as well. So I work with Tenebris Cancer Care, another charity in Wales, where I work with their Sing With Us choirs. And they have done specific research into how singing can affect the brain in mental health levels and everything as well. And a lot of their music leaders and choir leaders also work for the Forget Me Not chorus. So we see these from both the Sing With Us choirs and the Forget Me Not chorus choirs in the care home settings, where a lot of mental health for both the people living with dementia or cancer will really rise after a singing session. But we also see it for the carers as well. And for a lot of dementia research in dementia settings, people do forget about the caregivers and the people who are supporting people with dementia and how it can affect them. So one thing I wanted to say was how music can actually be an intervention for carers and caregivers and carers in care homes and family members and children and granddaughters and grandsons and whatever, because people don't realise the extent of how much a loved one having dementia can actually affect someone in the family who doesn't actually see it, but sees it every single day, sees their family member deteriorating, forgetting important parts, vital parts of themselves. And music can actually be very helpful for the carers in those in those settings as well, in those situations as well. I know that in the Sing With Us research, they've showed that a lot of the people who saw those benefits more were the carers, because they'd be run down, they'd be feeling very kind of defeated with anything they were going through with their partner's treatments. And Forget Me Not Chorus probably has very similar research, and they say that after a singing session, after going to one of the choirs, a musical intervention of some sort, they feel uplifted, they feel like they can go out and they can go and do things again. It's a massive mental health and well-being kind of boost as well, if that makes sense. I'm not sure if Frances has probably seen the same thing for any carers or loved ones that come along to her sessions.
It does that for everybody. It doesn't matter whether they've got a condition or not. I mean, that's what it's for, isn't it? That's what we make music for, is to inspire and lift people and find ways of mutual understanding that don't involve us using language or whatever it is. But it's a wonderful thing for anybody who gets involved in music. That's just it. And I should put in a little word for singing. So there's all these other art forms that are helpful for dementia. The biggest thing about singing is that it helps people to breathe properly, and breathing is one of the things that helps their quality of life, as well as their mental health and all the other things as well. And I think that's a really important thing to say. It's one of the things that we really focus on.
Yeah, we tend to do exactly the same. Breathing is a very integral part of the process of Forget Me Not Chorus as well. So I agree.
Just to add on to what you were saying there, Rebecca, and you mentioned it earlier as well, Frances, about obviously music being really useful for carers as well. So a thing that I've been interested in the past, in the music project that I did, was the impact of music sessions on staff and their reaction to patients on the wards as well. And yeah, having music sessions basically allowed staff, or helped staff, to see the patients more as people, to see them and to understand their background a bit more, and to engage with them as well. I think it was fantastic to see that, there was some staff who were quite, I suppose, negative towards the music sessions taking place, because they thought, well, what's the point in this? They're just getting in our way for doing our job. And then they saw the reaction in patients, and they saw the engagement between them, and they saw people getting upset and expressing their emotions about being in hospital. And they then actually thought, well, actually, this is a really good thing. They're engaging, they're talking, they're getting up and around and moving more. So it's just, the staff really started to actually appreciate the music and the impact that it could have, and then staff were joining in with the music sessions themselves. So it's so not just the patients or the residents and their family carers, but professional carers as well. It can really have an impact on them and really enhance that sense of seeing the person as a person rather than a patient or a person with dementia. They're seeing that individual.
Wondering if anyone had any questions. Feel free to unmute yourself.
A question for Frances. I know I'm on the panel, but so you're saying that you I suppose Frances and Louise, so you're doing work together, and you've got a show of that, do you, coming up?
Well, it's been made, the work has been made into a film, effectively. There's a half-hour series of 5 short films that are for the launch of the project, if you like, are being used as an exhibition in this gallery space. But we will be doing some live stuff on the Saturday. So we're going to be doing some live performing, and Louise, I think you're going to tell people a bit more than we can about what's going on.
I thought you were going to say Louise is going to perform there.
Well, now, actually, Laura, so Louise, how would you feel about
Oh my goodness. Yeah, no, I'm okay with doing a scientific lecture, but that's about as far as it goes for me. Thank you very much. But I was actually just searching for the posters to put in the chat, but we're going to be putting up posters about the events around life sciences. I will send you an invitation, Laura and Rebecca. I've already sent one to you, Ray. So on Saturday, we're going to be doing 2 live performances in the afternoon. So Frances is going to actually be in person that day. But as Frances said earlier, the audiovisual works that were done by the students in the workshop will be on show on from Wednesday the 19th of April until Sunday, the 23rd. And so the Phoenix studio is open from 11 till 5, I think, so you can just wander in anytime. The 2 live performances on Saturday will be at 2:30 and 3:30, I think.
Something like that. We haven't kind of quite finalised it. I think it's we'll be there all day doing stuff.
Yes.
So anytime you appear on a Saturday, something will be going on the Saturday.
And we're in the process of making up, preparing the website, which has pretty much got everything on it, I think, hasn't it? Oh, and if you wanted to listen to our podcast, which surprisingly I felt quite proud of, despite me being in it, I think Frances managed to make me sound not too bad, I thought. So I thought it was really good. If I could pretend it wasn't me, it would have been even better. But it's essentially me and Karen, who is another scientist with me, talking to Frances about the process of preparing the work, and then also playing some of the music and our reactions to it. It's rather lovely, I think. So yeah, so that was a good plug, wasn't it?
It was a very good plug. I mean, we will also be, once after the launch has happened, the film will be on the website and so on. So yeah, so there's lots of opportunities to look at it, and then hopefully it will be exhibited in other places, and we'll be able to do other live performances of some of the music as well.
Yeah.
Well, if you ever fancy doing an exhibit up in North Wales at some point, I'd love to come along and watch it.
Okay.
Lovely. You're on.
We like that.
I'm afraid on the you said it's the 19th to the 23rd of April, yeah? I'm afraid that weekend we've got the Forget Me Not Chorus has got termly sharer for the choir to show to the community what they're doing on the Saturday on the 22nd.
Oh, nice.
But I will be thinking of all the live performances and everything you're doing, and my sister goes to the University of Sussex, so I'll be pushing her to go along to the exhibit instead.
Oh, does she? Oh, that's nice. Oh, yeah, it's been really, really inspiring hearing about your work, Rebecca, and lovely to hear from you too, Laura, who I'm sure we've met at some point. But yeah, to see what you're doing with I mean, Ray and I'm sorry, I'm so sorry, my mind's just gone blank and I've forgotten your name. Oh no, it was on here. Oh, I'm sorry. It's just gone completely blank. Thank you for all your questions, which I think, yeah, it was really interesting debate. And
thank you so much for joining.
Yeah, it's been really nice to find out other people who are doing the same type of work. You just don't hear about it very often. This is the thing. So it's nice to actually meet people who do it as well.
Yeah, it was genuinely an honor to have you all and listen to your work, and it was quite informative, because I got to know about like a lot of things that I usually don't look into, and it was quite interesting to know about mainly the reactions that people might have, not only just people with dementia, but also like the cares, as you were mentioning, and how it can sort of impact them, and how them engaging in music can also sort of help in their well-being. And it was also really nice to listen to like Frances and Louise and Karen's project, who we were supposed to have for the event, but she unfortunately had prior commitments and therefore wasn't able to join us. It was quite interesting to listen to the work that you do with respect to like the Miss Folding podcast, and I'll make sure to attend the live event in April.
Great. Yes, it's lovely to hear from you, Laura, and Rebecca as well. Absolutely lovely. It's very inspiring and really helpful to hear people sort of talking about something that you're kind of working in that similar field, but you're doing very different things for very different reasons, and it's really wonderful to listen to.
This similar interest but different disciplines. It's really interesting. Yeah.
The science and arts are not that far apart.
Definitely not.
Just wanted to ask if anyone in the audience had any questions to ask, or we can.
Aaron's waving, I think. Oh no, are you just clapping? That's very nice. That's very nice.
Yeah, I was just clapping. Thank you to the panel. Yeah, I just wanted to ask actually, Louise, specifically, where can I find that podcast? Because I'm very interested.
Oh, I'll send out a link. I don't know if it seems a bit too much like
Well, this would go up in like the Sussex Neuroscience channel, hopefully, so I can sort of link it down in the video, if the podcast link.
Oh, sure. I can send you a few links to add to it. Shall I do that? I'll
Yeah,
send
sure.
you links.
Definitely.
So, for example, the BNA website is probably the best place to see the. Oh, I can't find it now. Yeah, I'll send them all to you, Ray, in an email.
Yeah.
So all the links you can add.
Link to a video that I've done with the research. We made a video of the research I did. I might send you a link to that as well, if that's all right.
Yeah,
Interest
sure.
people. Yeah.
If you don't mind, I might
Lots
send
of resources.
you the links for some of the Forget Me Not stuff that we've done as well, so people can see on it.
Yeah, definitely. Does anyone else have anything else to say? Okay, then thank you for joining us for the panel, and it was lovely to hear from all of you, and it was quite informative, and yeah, thanks for joining
Thank you
us.
for joining us.